Hi, my name is Lakeisha, and today I'm going to be showing how to administer medication in an IV mini bag. So first, before I start, I need to check my physician order. I need to check to make sure I have the correct medication, the right dose, the right route, and the right frequency. Also, I'm going to look at the lab results. I'm going to be checking white blood cells. I'm also going to check for any allergies, any history of any allergies that the patient has. So now I'm going to be reading my medication card. So the doctor has ordered Flagyl 500 milligrams every 6 hours via IV. The action of this medication is to kill anaerobic bacteria. It is a bactericidal drug. The purpose of this medication is to kill the C. diff infection to help kill the bacteria. The dose of this medication is 500 milligrams every 6 hours. The side effects include superinfection, headaches, and meningitis. The contraindications are hypersensitivity. This should not be taken in the first trimester of pregnancy, and hepatic impairment. The nursing implications is to obtain a culture before administering therapy, monitor the patient's intake and output, assess the IV site for phlebitis and infiltration. And also the infusion time is for over 30 minutes. All right, so now I'm going to be doing my dosage calc. So I have, this is a vial, it says 500 milligrams per ml for Flagyl, and I also have my normal saline for the flush. Alrighty, so 500 milligrams per ml. I will be giving my patient 1 ml because the doctor ordered 500 milligrams. Alrighty, now for my medication, for the fluids that I will be using, I'm going to be using a 100 ml bag. And the infusion time is over 30 minutes. And with my tubing, it says 10 drops per ml, so times 10 equals 33 drops per minute. Alrighty, so now I'm going to drop my medication. This is the Flagyl. I'll be drawing up 1 ml. Good, and I'm going to place it inside the medication bag. Fluids. And I will place this needle in the sharps container. Shake my bag. Now I'm going to label my bag. And on my label, I'm going to have the client's name, the dose, the medication name, the time, and my initial. While I'm drawing up medication, I'm going to go ahead and draw up my normal saline. And I'm going to drop 6 mLs. Good. And I'm going to place my needle in the sharps container. Good. And it would have a new needle on top. Just get rid of that. Now I'm going to go ahead and attach my needleless device to my bag. Make sure this is closed. Good. Now I'm going to label my tubing with the date, time, and my initial. All right, so let me go ahead and compare this. Make sure we have this back off. Put my clamp back on here. And this will be sterile. See? All right, good. All right, so now I am ready to go in patient's room. I'm going to grab my MAR. Here and all my medications. This out the way. All right, so I'm going to grab my MAR. Now I'm ready to go into patient's room. Hi, my name is Lakeisha. Can you verify your, I'm sorry. Hi, my name is Lakeisha. I'll be your student nurse today. Can you verify your name and date of birth? Okay, good. Patient stated name and date of birth, that's on the band. Dr. Smith, I'm sorry, Mr. Smith, Dr. Jones has ordered for Flagyl via IV. We will be using this to help with your C. diff infection, okay? Do you have any allergies of any medications? Any allergies to latex? What about alcohol or iodine or shellfish? Okay, good. So first I would wash my hands, place on clean gloves. And now I'm going to be checking the IV site. I'm going to be checking for phlebitis or infiltration. I'm going to check to see if any pain. Any pain, Mr. Smith? Okay, good. I see no redness, no tenderness. It's not leaking, and it does not feel cold. Okay, so now I want to flush. I'm going to wipe off my port. I'm going to, this is on, unclamp, aspirate. Good, I see blood. So I'm going to do the push stop method for 3 mLs. Right now I do not see any swelling, any pain. Good, I do not see any swelling. So I'm going to continue. Okay, good. Now I'm going to close off the line. Remove my 3 mLs because I'm going to need it later. Now I'm going to be ready to place up my medication. I'm going to wipe the port again. Place my medication on. I'm going to unclamp. Unclamp here. I'm going to establish the flow. All right, and I'm going to watch for 1 minute, and I should get 33 drops per minute. Okay, good. Once I have established my flow, I'm going to continue to watch periodically. I'm going to come back in and check on my patient. And before I leave out the room, I'm going to remove my gloves, wash my hands, come back, observe. And I'm going to keep coming back to check on the patient to make sure he's okay. Check for any reactions, any side effects of the medication, or if he's having any problems. So once I'm done, I came back, I'm going to come in, wash my hands, apply new gloves. So I'm going to look at the IV site. It's stopped now, so now I'm going to discontinue the tube. So I'm going to place some new gloves on. Alright, so these are new gloves. I thought I would wash my hands and looking at the site, and it is now to discontinue the medication for next administration. So I'm going to clamp it off, remove the tubing, clamp with my alligator clamp, place it back up here for next administration, clean off the port, and then flush with my 3 mLs that I have left. And then if there was any doctor orders after I get done flushing, doing the push stop method, unclamp, 3 mLs, push stop, good. Clamp, applying positive pressure. And if the patient had a central line or a PICC line, I would administer heparin per doctor's orders. All right, so this patient does not have a PICC line. So now I'm going to monitor for any pain or swelling. Monitor for any pain or swelling or heat. And I will also let the patient know to let me know if they have any leaking, if they notice any pain or swelling, or any reactions that they're having. So I'm going to remove my gloves. And I'm also, before I move my gloves, I would place all my needles inside of the sharps container and do anything that need to be thrown into the trash. And then remove my glove and then wash my hands. And then before I leave out the room, I would assess my patient to make sure he is in a comfortable position. I would ask him if he's having any pain on a scale of 1 to 10, if he needs any personal belongings, and does he need to go to the restroom before I leave, And to call me if he needs anything, the call light is here. Alright, so now I leave the patient's room, wash my hands. Now I'm ready for documentation. I will be documenting in my MARS. I'm going to document the correct drug, dose, and route, and time. Then I'm going to state the IV site, and I'm also going to record the amount of fluids that it took to administer the medication, and the intake and output for the patient. And that's it for my administration of via mini bag.